Name is Richard Tata. I'm a student with West Texas A&M University. I am currently doing my RN to BSN transition studies with West Texas A&M University. And I just want to thank you guys for taking your time to come listen to my lecture today. I know it's a huge sacrifice on your part, and I also would like to start by thanking my preceptor, Miss Karen Falcom, for creating this time to mentor me. The reason I invited you today is to talk to you guys about coronary artery diseases. And the reason I chose this topic is because being a cardiovascular nurse, as you all know, I work at Northwest Texas Hospital in the cardiology department. So we take care of people with heart conditions and vascular issues. So as a cardiovascular nurse, in recent years, we've been seeing younger and younger people coming to the hospital with heart issues, related to these coronary artery diseases. And in the past, it used to be believed that people within a certain age group, say younger than 45, could not have a heart attack. And the reason was people were younger, more active, so there was that assumption that they cannot have a heart attack. But lately, younger and younger people are showing up to the hospital with heart attacks as a result of coronary artery diseases. So I'm going to try to explain what coronary artery disease is. Basically, coronary artery disease is a disease which affects the heart, and it's as a result of buildup of plaque and plaque in the vessels of the heart, the arteries of the heart, thus narrowing the lumen. Now, if you think of an artery of a heart in terms of this straw, you see that blood flows through this end of the lumen to the other end, to actually perfuse the heart tissue and everything. So now when this plaque buildup accumulates in the inner lumen, when this plaque builds in the lumen of that artery, it narrows the circumference of that artery and thus impedes blood supply to the extreme end of the artery. And that often results to tissue ischemia or tissue death and, heart attacks and all that. Okay. Now, the question is, what constitutes this plaque? So plaque is mainly, amongst other things, a constituent of cholesterol. That is a combination of high density lipoprotein, low density lipoprotein, and triglycerides. And when all these molecules, when this plaque builds up in the arteries and reduces circulation to the tissue that is being supplied with blood and nutrients by that artery, it can lead to a heart attack. Statistics have shown that, according to the Healthy People 2030 statistics, 90.8 in 100,000 people die each year in the United States as a result of coronary artery disease. So when you do the math and imagine the United States has a population of, let's say, 200 million. And if 90 out of every 100,000 people die from coronary artery disease, then it's a huge number. So how do we acquire this disease? Now, we're going to talk about the risk factors of this disease, which are mainly divided in two parts. There are the modifiable risk factors and non-modifiable risk factors. Modifiable risk factors are those risk factors, things in your life that you can change, and it will reduce your risk of acquiring this disease. And these modifiable risk factors are things like reducing your cholesterol levels, tobacco or smoking cessation, managing your hypertension and diabetes, obesity, and increase in physical activity. Now I'll explain each of them. With hyperlipidemia, hyperlipidemia is just a fancy word for excessive cholesterol in the body. Cholesterol in and of itself is a very important molecule to the body because it helps the body in the building of cell walls, and also it's one of the major constituents of most hormones of the body. So cholesterol is actually necessary, but excessive cholesterol in the body becomes problematic, as it just floats around in our blood and can accumulate in our artery vessels, and over time it narrows the lumen of the artery, which can cause circulation issues. And if that artery is of the heart, then it causes coronary artery disease, as it impedes blood supply to the tissues of the heart. Tobacco cessation, basically when you smoke, you increase your risk of plaque buildup you increase your risk of plaque buildup in the body by increasing your cholesterol levels, and of course that can be problematic. Hypertension and diabetes. Okay, I'll start from diabetes. Diabetes, like as we very well know, is a very common illness, and what it does is it weakens the vessels of the body, and especially of the heart, and it can lead to endothelial injury. And when that injury occurs, it creates an area where plaque attaches to the vessel and eventually builds up over time. And also physical activity. It is recommended by the Center for Disease Control that an adult 18 and older should have at least 120 minutes of moderate to intense physical activity each week, and also should have at least 2 to 3 days of muscle building exercise. When I say muscle building, I don't necessarily mean going to the gym and lifting heavy weights. Just walking up and down your stairs, lifting very light weights repetitively can help to strengthen your muscles, or muscle strengthening exercise, so I should have said. And then we're gonna talk about the non-modifiable risk factors. The non-modifiable risk factors for this disease are things like your genetics. Genetically, coronary artery diseases run in certain families, and it's nothing the individuals can do about it. It's just the genetics, and the only way they could mitigate that risk is by controlling their modifiable risk factors. And also age. As we advance in age, we increase our risk of plaque buildup within the vessels of our arteries, and that can lead to coronary artery disease. And also gender too. It's been determined that men have a higher risk of experiencing coronary artery disease than women. And this is quite concerning to me as a man. So how can we do to prevent this coronary artery disease? There's different strategies we can employ to reduce our risk for coronary artery disease. And these include reducing our cholesterol levels, that is increasing what we call the high density lipoprotein levels, and reducing our triglycerides and low density lipoprotein levels, increasing our physical activity, managing our diabetes and hypertension. Basically, that is all I can explain to you as far as coronary artery disease is concerned. Does anybody have a question?
Yes, I do have a question. So, are you saying that it's okay for someone to take aspirin during a heart attack?
Yes, aspirin is one of those medications that they give in the hospital whenever somebody is having like a heart attack. It's one of those primary medications that is given. But taking aspirin long term in order to prevent a heart attack is not safe, because